Good afternoon. My name is Susan Himbeer, and I'll be presenting the strategic plan of developing a nursing float pool. Today, most institutions are seeing high vacancy rates for nursing. We have to look at how we can best staff our units to best serve not only our patients, their families, but our nursing staff as well. How can we support them? So who are our customers? Like previous mentioned, it's not only our patient's family, but it's our nurses. It's the hospital itself. It's of our administration. This institution spent system-wide almost $1 million last year in agency nursing. Agency nurses are not our employees. They are not engaged. I am presenting today that we hire a full-time, benefited, appointed nursing float pool. So why do we need to do it? Well, to decrease our $500,000 deficit that we spent last fiscal year in this particular institution to hire agency nurses. We want to hire the highest quality of experienced nurses to provide care for our patients, to provide not only support for our patients, but for our nursing staff as well. This will help in the decreasing turnover rate. We want to maintain the best nurse-patient ratios to provide quality outcomes for our patients. So how are we going to do this? We will hire 5 FTE of experienced nurses, no less than 2 years of experience, both in med-surg and in ICU areas. They'll be credentialed in any and all areas that they're assigned to. They will meet any and all standards of practice to the units that they serve. I will invite the nurse managers to participate in these interviews. I feel if they do so, that will provide some buy-in into this process. So what is this process going to look like? Once this pool is established, it will cover all call-in rates, which right now, at this particular institution, we are experiencing a 2 to 3% call-in rate per day. It will cover any and all FMLAs submitted to myself, the pool manager. It's being proactive with our staffing needs instead of reactive. By providing me with a list of their deficits 2 weeks prior to the schedule coming out to our staff, I'm able to pre-schedule these float pool nurses to fill those deficits. So how will I prioritize assigning staff? Those with the greatest of needs will get more of the float pool nurses. If there are no needs, will the float pool staff be canceled? Yes, but they will fall in a rotation to do this fairly and just. Are the pool staff full-time employees? Yes, they are full-time employees. Consider them a mobile nursing unit. They're just not always in one spot. I feel that this presentation will help support the plan to make our staffing more flexible, to provide support for our units as a whole for this institution, decrease overtime, and decrease the use of agency nurse. I thank you. I hope you found this helpful, and I appreciate any and all feedback.